Good morning, everyone. I'm Kelvin. The topic of my prepper conference is Enhanced Detection of Retinal Blood Vessels by Integrating DSI-BBCCE into Tyler Coye algorithm. These are the authors as well as their affiliation. Without further ado, I'm going to talk about diabetes first, as diabetes is the leading cause of death in the world. It contributes to nearly 5.2 million deaths, and in the world, there are around 422 million adults that have diabetes. This is according to World Health Organizations. There are three main types of diabetes: type 1, type 2, and gestational diabetes. The consequences, it can increase the risk of premature death, which is stroke, blindness, heart attack, kidney failure, and worse, amputation. Secondly, I'm going to talk about diabetic retinopathy. It is caused by diabetes. How does it happen? Over time, too much sugar in the blood cuts the blood supply. As a result, the new attempts to grow new blood vessels. However, these new blood vessels leak easily and cause leakage and blocks the normal vision and eventually near blindness and tiredness. Thus, early horoscopic examination should be taken regularly to prevent and monitor the stages of diabetic retinopathy. These are the three clinical features, which are microaneurysms, heart exudates, and hemorrhages. Besides that, there is another clinical feature of diabetic retinopathy, which is the narrowing on vitreous and the widening of venous, which is in the research. This effect can be seen progressively with time. The question is, why do we need to segment the vessels? It is important because the vessels can be measured, the diameter can be measured for diagnosis by the ophthalmologist to monitor the progressive stages of diabetic retinopathy. What's the problem? The problem lies due to the pre-processing images. There are noise and the contrast enhancement is poor. Let's see the literature review for the contrast enhancement. At first, the histogram equalization, which is generally used by everyone and a lot of people. It is simple, however, it causes artifacts. Secondly, additive histogram equalization developed by Bezier. It solved the images that have increasing and decreasing intensity down the image. Thirdly, he developed CLAHE, which is contrast-limited additive histogram. After that, Kim from Korea, he developed the mean preserving Bi-histogram by dividing the input image into two sub-histograms based on the threshold, average of the mean and median. After Kim, one developed another one based on the threshold median. And after several years, Gant, he developed the Bezier curve and put it into the cumulative distribution function to make sure the contrast enhancement is not over-enhanced. Next, I'm going to talk about vessel segmentation. These are the literature review of vessel segmentation, and the vessel segmentation method that we use in this paper is the Coye-Taylor algorithm. Why? Because it reduces the complexity of the analysis and speeds up the segmentation progress. This is the continuity of the previous literature review for vessel segmentation. From the literature review, we propose an approach of dualistic subimage that is based on the threshold median, and we applied a new Bezier curve contrast enhancement in the cumulative distribution function into the Tyler Coye algorithm to segment the vessels. The scope of the research is using 2D fundus images. There are 20 retinal images which is obtained from digital retinal images for vessels extraction drive. This is the BBCCE flow chart, which is based on the mean threshold, while DCSI-BBCCE is based on the median threshold. Next, this is the Tyler Coye algorithm. Firstly, the RGB input image is input. It is converted to grayscale, and the contrast enhancement method, that is CLAHE, after that it is excluded from the background. After that, it is converted into a binary image, remove smaller components, and the network of blood vessels is formed. With that, we propose a novel extension which will replace the CLAHE method with DSI-BBCCE. This is the methodology flowchart. There are three different experiments of contrast enhancement, which are CLAHE, BBCCE, and DSI-BBCCE. After we get the blood vessel segmentation, we evaluate the assessment to see the accuracy of the segmentation. This is the equation for the plot of NK against XK and the median equation. Secondly, the Bezier curve equation, where Pi are the control points. Bezier curve of third degree should have 4 control points. At the same time, if the Bezier curve has a second degree, it should have 3 control points, etc. This is the evaluation assessment, that is sensitivity, specificity, and accuracy. This is the evaluation matrix description. Let's talk about results. Firstly, the image is original. Then beside it is the ground truth image, which is manually drawn by ophthalmologists. The second row is the original Tyler Coye algorithm, CLAHE. You see the gray image and its vessel segmentation. After that, it is the BBCCE integrated Tyler Coye algorithm and DSI-BBCCE integrated Tyler Coye algorithm. The following shows the performance evaluation of 20 fundus images calculated averaged. So, sensitivity, specificity, and accuracy. Figure 10 shows a bar chart graph that shows the comparison of performance evaluation of CLAHE, BBCC, and DSI-BBCCE. As a whole, in Tyler Coye algorithm, BBCCE has the highest sensitivity. However, BBCC achieves the lowest specificity. For the case of DSI-BBCCE, it is the other way around. DSI-BBCCE performs the highest specificity while the lowest for sensitivity. For CLAHE, if compared with the other two, ranks the second place in all evaluation. This leaves accuracy, the only indicator for BBCCE and DSI-BBCCE on determining which one performs better in all aspects. From the bar chart, DSI-BBCCE has the higher accuracy than BBCCE. Brightness. From a brightness perspective, BBCC and DSI-BBCCE images look brighter. Of course, they are, as they have the feature of preserving an image brightness, since its method involves separating histogram bins into 2 sub-histograms. For the CLAHE image, it has an over-enhanced look. The real challenge lies after the segmentation of the vessels. BBCCE relies on the value of mean as the threshold, while DSI-BBCCE relies on the value of the mean when partitioning into bi-histograms. For the vessel segmentation discussion, CLAHE produces cleaner vessel images where the background of the vessels have less noise due to smaller components are cleaned efficiently. However, the tiny veins at the very end of the large vessels are poorly segmented. On the other hand, BBCCE and DSI-BBCCE vessel images have a messier look at the ends of the veins, but from another perspective, tiny veins can be segmented. I believe this could be caused by the blur effect of the average filter. As what we discussed earlier about the performance discussion. Last but not least, in conclusion, the proposed DSI-BBCCE method performs the best overall despite the lowest for sensitivity. The mean brightness can be better preserved due to bi-histogram, and the degree of the contrast is not high due to smooth Bezier transform curve. So it solves the brightness and it solves the contrast enhancement degree. The authors are gratefully to UTM and the Research Management Center providing support under the Research University grant. These are the references. Thank you.